We're going to be talking about natural relief for pain and inflammation. This is probably the most important webinar in the series because all disease is inflammation. What you learn here will apply to every single patient in your office. My name is Paul Varnes. I'm a chiropractor. I've been in practice for 36 years. I've had an all-cash, all-referral practice. I've taught nutrition at National. I've written a few books. And by way of disclosure, I work with Zorix International. They're a great company. A lot of the companies I used to work with now are owned by multinational corporations. Zorix is independent and they're practitioner oriented. They're run by people who are interested in getting people better and they're interested in helping practitioners grow their practice. Give them a chance. I spent the last few years finding research that justifies natural health care and compiling it, and this is a little pet project of mine. It's wholehealthweb.com. Please give it a look. I'm adding more material all the time. And the reason I'm doing this series, and actually the reason I started wholehealthweb.com, is that healthcare in the United States costs $3.7 trillion per year. That's $10,000 for every man, woman, and child in the country. It represents 18% of our GDP. And it's too expensive because the pharmaceutical industry has defined for us what is science and what is health. And we're the answer to that. We can cut these costs by quite a bit. Here's a cost of in the United States of the things that you should be treating. If you'll notice, it amounts to over $1 trillion worth of cost. At the top there is chronic pain, which is $300 billion a year. That does not count lost productivity. That is just out-of-pocket cost. We're going to be talking about diet. And a big part of the problem is Americans are fed by a food industry that pays no attention to health, and we're treated by a health industry which pays no attention to food. So what if there was an entity that caused a new cancer, created a new skin disease, tripled the incidence of diabetes, increased the incidence of gallstones, and quadrupled cardiovascular disease in men over 40? You'd be shocked. It'd probably be on the cover of Time magazine. There'd be a lot of news coverage. And this has happened. It's happened within a generation. It happened to the Inuit living in northern Canada. This is from an article by Otto Schaefer, MD, called When the Eskimo Comes to Town. The article was written in 1971, back when it was okay to say Eskimo. Prior to Dr. Schaefer's article, Weston Price went around the world in the 1930s. He was a dentist, and he paid attention to the same ethnic group and compared those that were living in quote-unquote civilized societies to those that were living in more traditionally. In other words, people that had been exposed to the Western diet versus the people who had not. And what he noticed was the people that lived in uncivilized conditions had very little cancer, heart disease, no obesity, sinusitis, allergies, diabetes, GERD, all the problems we take for granted. Even their bone and teeth structure was better. After generations, Price was a dentist, he would look at the dental arches, and if you look at that picture there on the left, that's a person's several generations after a Western diet, and the woman on the right, a traditional diet. And the funny thing is, if you Google Dr. Price, you'll see him criticized by medical shills like Quackwatch. They'll criticize him and say, oh, the savages aren't that healthy, but they're missing the point. And the point is, it's not about how healthy the uncivilized people are, it's about how unhealthy we are. And research supports Price. If you go on PubMed, you find over 1,300 clinical studies that trash the Western diet. The Western diet causes inflammation. And as a little aside here, with COVID, a couple of Harvard researchers found that they could test who's going to have a severe case of COVID, end up in the ICU and all of that, and who isn't. And all they're doing is they're testing inflammatory markers. Well, we know what to do for those, don't we? And I want to talk a little bit about talking about diet with your patients. If you focus like a laser and cover all the bases and get them to follow a good diet for 30 days, you will get amazing results. You will not believe how good the results are. And a lot of people do not insist on as strict a program as they should because they're worried about patient compliance. Okay, sugar and processed foods are addictive, and many of us are concerned that patients won't comply. And you don't have to be a food Nazi, But insist on 30 days compliance. Tell them they can do anything for 30 days. And it's not like you're going to make them eat a certain way for a lifetime. You want them to see how good you feel. And I'm telling you, I don't care what's wrong with the patient. If you do what I'm going to present to you here, you'll be surprised at how little else you have to do. Most diseases, inflammation, your patients are going to do amazingly. Another thing you should mention is don't limit the food. Tell them they can eat as much as they want, even though it's a diet. A lot of these people that are having problem are overweight, and they might try to turn it into a diet. Tell them not to do that. They can, if they're hungry, go ahead and eat. Leptins will bite them in the butt, and they will regain that weight. Tell them eat as much as you want. And then give them a roadmap. What I mean by that is a lot of times our dietary advice is not very organized. We'll say, oh, quit sugar. Oh, don't, yeah, that stuff's bad for you. And, you know, we don't do it in an organized fashion. If we do it in an organized fashion, the results are amazing. And to fight inflammation, we're going to start with diet. And since we're only going for 30 days, this is going to be a little bit strict, but tell them once they're through the 30 days, we can talk about how they can break discipline a little bit. And you want them to avoid obvious junk: sugar, refined carbohydrate, chemical additives, processed foods, processed vegetable oils. I read a lot about how much omega-6 oil we get, but if you're talking about canola oil in the supermarket, no, you're not getting good omega-6 oils out of that. And you want them to avoid GMOs. They disrupt the microbiome. Also, a lot of foods are genetically modified so that they can be sprayed a lot. Okay? Have them eat organic whenever possible. Basically, if it comes in a bottle, box, or a can, or it wasn't available 10,000 years ago, it probably isn't good for you. Also, since by the time most people show up in your office, they've also got some sort of digestive problem. So we're going to add an additional discipline. This will also reduce inflammation as well. We're going to have them go on the specific carbohydrate diet or the paleo diet. I use the two interchangeably. The paleo diet automatically follows all the discipline of the specific carbohydrate diet. The specific carbohydrate diet has a few things in it that would not be allowed on the paleo diet. The diets are built on the idea that we eat too many carbohydrates and too many complex carbohydrates. Fruits and things, it's not a low carb diet. Fruits and things like that, single sugars are allowed. Disaccharides like sucrose is a table sugar is a disaccharide. Lactose, which is in milk, so dairy products are not allowed. Those have to be broken down by enzymes. Starches like kidney beans, potatoes, wheat, things like that have to be broken down by the pancreatic enzymes. And what happens is you eat so many of these foods, you have incomplete digestion. And the food that goes into the small intestine and the large intestine, it doesn't get digested. It rots, and you start growing flora that doesn't belong, that feeds on the undigested food, and that irritates the small intestine, the mucosa of the small intestine. The small intestine mucosa is supposed to be producing enzymes to further help you digest. So what happens? You start damaging those cells. You get the decreased production of enzymes. And the incomplete digestion gives you more improper flora, and it's called the vicious cycle. And Elaine Gottschall wrote about it in her book called The Vicious Cycle. The diet is from Dr. Sidney Haas. And there's a lot of research supporting the use of the specific carbohydrate diet for mostly inflammatory bowel disease, in other words, ulcerative colitis and Crohn's disease. But clinically, I found that just about any digestive problem improves on this diet. And like I said, I'm going to use the specific carbohydrate in the paleo diet interchangeably. So in the studies looking at digestive issues, it's looking at the specific carbohydrate diet. When it's looking at other issues like inflammation, insulin resistance, it's looking at the paleo diet. And the paleo diet is very good for your patients with insulin resistance. Here's some of the research. There's a lot of research supporting the use of the paleo diet for insulin resistance. Carotenoids are pigments produced by plants to protect itself during photosynthesis, which has a lot of oxidative stress. These are, orange, yellow, red. They're fat-soluble pigments, including carotene, and they give color to the plant. And they're in all fruits and vegetables, okay? Things like carotenes, lycopene, zeaxanthin, you might have heard these terms. These are carotenoids. Another powerful antioxidant produced by plants are polyphenols. Bioflavonoids are polyphenols, flavanols, all those. They're polyphenols, and they're characterized by this aromatic ring and a hydroxy group. You might remember from chemistry. Okay, they include things like quercetin, hesperidin, silymarin, resveratrol, things like that are polyphenols, and they also protect the body. They're powerful antioxidants. They're powerful anti-inflammatory, and this is what carotenoids and polyphenols are. What's in your fruits and vegetables. In the diet, polyphenols and carotenoids improve and treat digestive issues, weight management difficulties, diabetes, neurodegenerative disease, cardiovascular disease, but mainly they reduce inflammation. So that a diet high in brightly colored fresh produce will combat pain and inflammation, and probably more than you could ever believe. There are a lot of studies that show that these things fight inflammation. Here's a few, and here's a few more. Powerful anti-inflammatory activity from fruits and vegetables. But not only that, they help you to lose weight. They help with sugar handling issues. They're good for your patients with insulin sensitivity, type 2 diabetes. Once again, extensively studied. And since a big component of cardiovascular disease is inflammation, lo and behold, polyphenols and carotenoids help protect from cardiovascular disease. They're also neuroprotective, help with cognition, and help prevent neurodegenerative disease. I don't do much stool testing anymore because polyphenols and carotenoids, the things that I'm going to insist on in their diet, helps protect the intestinal lining, helps balance the microbiome. The other thing that I would like to add about stool tests and bowel flora and such, wise man Harry Eidner once said that the digestive system goes wrong from the north-south. In other words, make sure they're getting enough hydrochloric acid, make sure they've got adequate pancreatic enzymes before you start worrying about what's going on in the colon. And I think that makes perfect sense. Also, the diet we're going to present here works so well, you'll be surprised at how little stool testing or other testing you'll end up doing. Patients do very, very well. All of them will at least improve, and you'll be surprised at how many of them just get better. Inflammation is also a component of cancer. Polyphenols and carotenoids help protect from cancer. There's some studies. So ask all your patients for 30 days. Insist on it. You'll be surprised at how easy your job gets. You want them to avoid all the obvious junk, the packaged foods, hydrogenated oils, chemical additives, sugars, and so on. You want them to eat slowly. We didn't talk about that earlier, but that's very important. A lot of digestive problems start with the mouth. You have amylase in your saliva, helps break down carbohydrates, have them chew their food. Also, breaking down small little particles of food in the digestive tract is a lot easier than big chunks. You take iron shavings and put them in hydrochloric acid, they dissolve. You put a same weight nail in the hydrochloric acid, it takes a while to break down. You also want them to eat paleo, okay, no starches, no disaccharides. We have that written up for you. And then 75% by volume, fresh fruits and vegetables. You want them to get those carotenoids and polyphenols. Also, the paleo diet, if you tell someone just go on a paleo diet, their inflammatory markers will go up because they tend to eat a lot of meat. They tend not to eat a lot of vegetables. And there's a lot of arachidonic acid, and that's very pro-inflammatory. So you put them on a paleo diet without instructing them to eat vegetables, their digestion may improve, but their inflammation is going to go up. So make sure you insist on fruits and vegetables. Have them avoid GMOs. There's a lot of problems. They're heavily sprayed. I believe they mess with the microbiome. And then have them eat organic whenever possible, and then drink water. And this will very often go like a negotiation. We had one person ask, can I have Dr. Pepper with this? Coffee drinkers will want to know if coffee is ideally not something they would want. Maybe they have a drink at the end of the day. With habits like smokers are another problem. What I like to do in my own office is I let them keep their treasured habit for 30 days and then have them do the program the second time, giving up the treasured habit. And that usually works well. Like, for instance, coffee drinking. Uh, coffee, many people will have a horrible headache, fatigue. They actually withdraw from coffee, and that'll make compliance very difficult on the program. So negotiate and find what they can do. And the fact of the matter is, if you get them doing this about 80%, they're going to still do a lot better. And what this accomplishes is it fights inflammation, it helps most digestive issues, it's nutrient dense, improves the microbiome, it addresses insulin sensitivity, and improves liver function, helps eliminate toxins. I can think of one patient recently, very, very bad reflux, lots of digestive problems, had asthma, like that. And we got her to do the diet. I wanted to give her hydrochloric acid, but her stomach lining wouldn't tolerate it. She found that if she stayed on the diet, all of her symptoms were gone, all of them. If she cheated a little bit, then they would come back. And this is kind of what you want to accomplish. You want them to link the habit to the symptom. And the fact of the matter, you can tell them this. I found that really, really sick people, your fibromyalgias or people with 900 little symptoms that they're going on, they have to follow it for about a year. And then they can start cheating. George Goodhart used to say, you can go downtown and have Coney Island hot dog and a beer and it shouldn't bother you. But if you do it 2 days in a row, you're crazy. And that's true, but for a lot of the people that show up in our office, Coney Island and the beer is going to kill them, especially if you get them on a program. But they do get better. Things improve. Their digestive lining improves. Their enzyme systems start moving. And we're going to talk about how that happens in a few minutes. This is in the first webinar, which you can find on YouTube if you search my name. And this is important because we need to understand that we're not treating disease, we're actually building infrastructure. And once you get out of the fixing disease model, your work gets a lot easier. This is a model created by Emmanuel Sharaskin, and basically what he said was, if you have all the components of health, good diet, good structure, good emotional health, clean environment, whatever, all your enzyme systems work, your hormone systems work, you got good biochemistry, you have good physiologic performance, and no signs or symptoms. But if you interfere with the core components, you start having problems. Eventually, you start having enzyme problems. Say you're not eating a nutrient-rich diet, you start coming up short with B6, magnesium. Your body saves it. Enzymes don't work as well as they should. Goes on for a while. Hormones don't work well. A good example would be eating a lot of sugar. You start having problems with insulin. You start having problems with adrenal hormone. Eventually, your whole biochemistry goes a little bit screwy. And then physiologic performance is affected. And this is an important one because this is the patient that goes from doctor to doctor, gets tests, something's wrong, I don't feel the way I used to, but no one ever finds anything wrong with them because they don't have any signs and they don't have any symptoms. You guys might find things because you have other ways of looking that show you the functional problems. Eventually, they begin to have signs, which are lab tests that are wrong, and eventually they have symptoms. So medicine works out here. Okay, they're manipulating the symptoms. You got reflux, we're going to give you an antacid. You got pain, we're going to give you an anti-inflammatory. You got asthma, we're going to give you something to open up your airwaves. We're working in here, and that's what this diet is all about. We're rebuilding the infrastructure, and the idea is as you improve this big blob shrinks and pulls away from the symptoms. To give you an example, magnesium, you give an asthmatic magnesium, 90% of the time they're going to do better. They're going to get some improvement from the magnesium. But magnesium doesn't treat asthma. Magnesium treats a magnesium deficiency. So if an asthmatic is magnesium deficient, their symptoms are going to be worse. You fill in the magnesium, the little blob shrinks a little bit. So you're not really treating disease. We don't treat disease. And you're busy, so we put all this into a book for you to give to your patients. The PDF is free. You can email me. I'll send you. You can use it as often as you like. You can get a printed version from Zorex International. There's their contact information. Just if you're a customer, if you're buying from them, you can get print versions of this. And it's a useful tool. It's got meal plans. It's got recipes. It makes the whole thing very easy. And we're going to talk about pain right now. You probably already know you can do a better job than medicine can with pain. And what we're going to show you today, it'll be even that much better. Right now, pain costs between 260 and $300 billion a year. That's actual out-of-pocket costs, doctor visits and pills and whatnot. And when you count the financial burden, the loss of productivity, jobs, that kind of thing, it about doubles. First, we're going to talk about nonsteroidal anti-inflammatory drugs, which is a mainstay of our pain therapy. And you probably already know they're not all they're cracked up to be. It says 40% of NSAID users have GI symptoms. I would hold that it's more than that. The increase of ulcer risk is tenfold. Most of 25% have ulcers, and a lot of them have irritable bowel syndrome symptoms. And you may have already seen this, where you have someone comes in and they got all kind of GI problems. It turns out they were in an accident a few months ago and they took a lot of ibuprofen. Or you might notice that your arthritis patients are developing GI problems just because they're taking ibuprofen or some other anti-inflammatory drug. And NSAIDs are responsible for 11% of preventable drug-related hospital admissions. And there's other problems as well. They're linked to high blood pressure, heart failure. Kidney failure one is interesting. If you can find the New York Times article from January 29, 2002, it's about NBA players who are in the habit of popping ibuprofen before a game so they don't hurt so much afterwards. It turns out there's a lot of kidney disease in the NBA because of this, and the New York Times did an article on that. Also, people are injured, they take these things, and lo and behold, it inhibits bone repair and cartilage repair. Think of arthritis patients taking ibuprofen, and it's interfering with cartilage repair, so they're getting short-term relief for long-term degeneration. In our last webinar, Science of Communication, which you can get on YouTube, we talked about the pharmaceutical industry funding studies, getting them published. It's a big income source for the medical journals. And there's a pattern that happens. They fund a study, they hide the flaws in it, which is what happened with opioids. They fudge their results, and then they massively marketed the drug to physicians and massively marketed to the public. And lo and behold, we have an opioid crisis. Surprise, surprise. And the pharmaceutical industry has a lot of influence in the FDA and the science community. And a good example of that is Vioxx. It took 2 years to get Vioxx off of the market from the time that they realized they were increasing the risk of heart attack and stroke. Also, there's a couple of COX-2 inhibitors that are still on the market, and they probably cause the same problem. One of the problems with the Western diet is the funny oils in it. We've got hydrogenated oils, trans fats, and processed vegetables oils. Omega-6s that really don't give you omega-6. They're chemically treated, they're overheated, they're not really food anymore. So giving a good oil can reduce inflammation, it can help with blood glucose control, it helps with serum lipids, and it helps with brain and cognition. Alpha-linolenic acid, which is found in flax oil, has been shown to reduce inflammatory markers, improve menopausal symptoms. It's also good for glycemic control and diabetes. It's also anti-inflammatory and protects from heart disease. We eat a lot of processed omega-6 oils that are not nutrient active. But omega-6, a good omega-6 oil, there's studies that show that they too help with blood lipids and insulin resistance, cognition, same sorts of things. Came across a few studies for dry eye and inflammation of the eye in omega-6 oils. Also, a balance of omega-3 and omega-6 is very good for ADHD. You don't want to just give fish oil. And I want to talk a little bit about fish oil because people say, oh, there's all these studies, omega-3 fish oil, and different vitamin companies are trying to get higher and higher dosages of fish oil. The problem is the oceans are full of dioxin, mercury, and plastic, and a good company will test for dioxin and mercury. I don't know how they're testing for plastic. There's all kind of lightweight chemicals there. Dr. Ray Peat at raypeat.com, he's an interesting fellow. He's a PhD biologist or maybe biochemist, as a teacher, and he's hell on omega-3 fatty acids. He says the research is flawed. I think there's so many good studies for omega-3 fish oil because Americans eat 30 to 1 omega-6 to omega-3. You get very little omega-3 in our diet, lots of omega-6, and they're funny, toxic oils to begin with. So you give somebody like that a clean fish oil product, and lo and behold, you're going to get a nice result. I think it's only good short term, though. And like I said, Ray Peat says terrible things about fish oil. And go to his website. He's got a lot of interesting information. He puts out a great newsletter. But your problem with glucose handling, linked to cancer, liver damage, immunosuppressive, anti-thyroid. It goes on and on. And he's got the studies to back up what he's saying. So we'll give Zorex a little plug here. They make a product called Sunflax Complex, which is all vegetable. It's not going to have the dioxin and mercury. It's made with flax oil and sunflower oil. And it's at a 3 to 1 ratio, omega-6 to omega-3, which turns out to be what our membranes kind of like. And as a long-term product, this is a good way to go. If you're going to use fish oil, maybe a bottle, but I would go ahead and give them the stuff that they need. And consider for the same sorts of things that you're using your omega-3 fatty acids for: cardiac insufficiency, atherosclerosis, blood fats, hormonal issues, pain, and of course inflammation. And if you get the right oil in people on top of the dietary things we're talking about, you're going to do a lot to reduce pain. Things like prostaglandins, a lot of the biomarkers for pain and inflammation are fats. Are fats. And there's the product. This is a really good product. I had a patient recently, I'm talking about people recent, that had an itchy, taking fish oil, still had itchy, scaly elbows, and switched into the Sunflax Complex, and within a couple days, the itch went away. The other thing that's very well studied for reducing pain and actually promoting healing and reducing inflammation are pancreatic enzymes. If you take pancreatic enzymes with food, they'll help you to digest. But if you take them on an empty stomach, they reduce inflammation and promote healing, and they will get people out of pain. I have a little story to tell right now. I was supposed to take over the practice for a fellow. He was going in for surgery. I said I'd run his practice and mine for a couple of weeks. And that was going to be on the Monday after Thanksgiving one year. On Thanksgiving evening, I got a back pain, sciatic, hurt so much I couldn't stand. I had a foot drop, and I was in horrible, horrible pain. And what I did was I took pancreatic enzymes and I followed the diet that I just covered with you. By Monday, I was completely out of pain. Still had the foot drop, which is kind of interesting, but I had no pain at all. I was able to run his practice and run mine for the next couple of weeks. And of course, I'm a chiropractor. I was getting adjusted. I was getting other things done. But I was not able to get adjusted before that Monday. And the pancreatic enzymes did it. And they're well studied. They speed healing. They help with postoperative pain. There's even a study here that talks about infections and healing. And they've actually tested these things head to head with drug anti-inflammatories, and they match up. Okay. One of the things I never liked about pancreatic enzymes was most of them only have about 3 milligrams of chymotrypsin, so you got to take fistfuls of them. Many of the companies make a small dosage. 8-X-Pancreatin has 25 milligrams of chymotrypsin, so to one of the Zorex is almost like 10 of those of other products. It also has Physin. This is a very, very good product. So this is the program for anybody in pain, and I promise you, you will be stunned at how effective this is. You have them avoid foods that cause inflammation. You have them avoid foods that, or you have them take foods that reduce inflammation, brightly colored produce, and so on. And then we're going to I didn't mention the paleo on the slide, but you do want them to follow paleo. That's the first discipline that'll go away, by the way. After the 30 days, you can start introducing complex carbs and see how they do. They do it one at a time. The paleo diet is also very hypoallergenic. So food allergies like corn, wheat, dairy are not on it. So if a patient tries a food and they react, they bloat, they have problems, you know that's a food they should not be eating. And you can gradually increase the amount of starch they eat, find out how much they can actually have. Most people can have some, and the diet gets easier to follow. And then the primary supplemental support, you get 8x pancreatin, two capsules 2 times a day on an empty stomach, usually the first thing in the morning, the very last thing at night. And then Sunflex Complex, 2 capsules 3 times a day with meals. This will work better than any drug therapy you could think of. There's my contact information. If you want a PDF for the roadmap to health, contact me. I'll send you one. If you want a printed copy, contact Zorex International. If you're a customer, they will send you printed copies of it. They also have a free document written by Harry Eidner called Clinical Insights. It's full of clinical pearls and little tricks that'll help you with your patients. It's very much worth getting. Also comes with an audio file. The other thing I would like to say is I had a cash practice for 36 years, and I got pretty good at patient communication. I've written newsletters. I've written newsletters for other vitamin companies also, and I have a lot of material that can help with practice growth, patient um, education. You got newsletters, anything that you need or anything I can do to help you with your practice, please feel free to contact me. I see, like, especially with COVID, a lot of practices are struggling and stuff. And I studied under a good marketing guy. I know a little bit about it. I was able to run a successful practice myself, and I'm happy to help you. Also, new customers, if you use the code PV10, Zorex will give you free shipping. And then our next webinar is going to be about insulin insensitivity and type 2 diabetes. This is something that all these patients should be going to us. Diet outperforms drugs. But once again, you want to do it focused. You want to do every little thing that you can. And there's a certain discipline that you can pretty much be sure to get people out of type 2 diabetes. Okay, and you go on YouTube and you can see the first webinar, which is Science and Communication. You can find it on YouTube. Take a look at that. And I thank you for your time.